Chapter 24, Infectious Diseases and Sepsis. During this chapter, we're going to cover infectious diseases, sepsis, and some common communicable diseases that you may run into. When we talk about infectious diseases, we're referring to diseases that can be spread from individual to individual. These are many times caused by bacteria, viruses, or other microbes, such as fungi. Communicable diseases can be spread through direct contact or contact with secretions. There is a timeline for each disease and how it is spread. When an infection causes illness, the time from exposure to the first symptoms is called the incubation period. The interval when the patient is shedding or releasing infectious material is the communicable period, when they're likely to make others ill. The timeline on how diseases are spread is unique to each disease, but other factors that may influence infection disease rates include virulence, or the strength of that microorganism, dose, how concentrated is the microorganism, route, how did it get into the body, and the body's resistance. Do you have antibodies or have you received vaccinations regarding this illness? Sepsis is an infection that is now in the bloodstream. This is life-threatening and can result in abnormal and counterproductive responses from the body. This response can cause damage to the tissues and organs that it usually protects. Septic shock occurs when these changes result in shock and hypotension that do not respond to our typical treatments, including intravenous fluids. This image is on page 675 of your textbook, but it looks at the process from localized infection to septic shock. Your infection at the local level means where the infection originally occurred. As the infection continues to grow within the body, it spreads sepsis, or systemic reaction. So the body begins to fight this, producing lactic acid and other chemicals. However, once the body becomes exhausted, if we have not gained control, it can lead to septic shock. With septic shock, we've got a systemic reaction along with hypotension that is not responsive to our normal treatments. There are several infections that commonly lead to sepsis. This includes pneumonia, GI tract infections, including abdominal surgeries or pancreatitis, genitourinary tract type infections, including kidney or prostate infections, or urinary catheter use. Another common cause of sepsis is breaks in the skin. This may be related to long-term IV use, PICC lines or central lines, tracheostomy or gastrostomy tubes, or pressure sores. We're still learning about sepsis. As patients develop sepsis, we may see changes in their vital signs. The Systemic Inflammatory Response Syndrome, or SIRS criteria, includes a temperature below 96.8 degrees Fahrenheit or above 101 degrees Fahrenheit, a heart rate over 90, a respiratory rate over 20, systolic blood pressure less than 90, or a new onset of altered mental status or worsening mental status. The Quick Sepsis-Related Organ Failure Assessment, or QSOFA, resembles the SIRS criteria. However, it does not predict whether someone is septic, but tells us what's the likelihood that they're going to die because of sepsis. As we're taking care of patients, look for signs of sepsis. If you can identify an infection, sepsis may be possible. Provide supportive care to your patients. If the patient meets the SIRS or similar criteria, then we need to inform the emergency department. Many times they will call this a sepsis alert. When assessing and caring for a patient who may have an infection or sepsis, there are a few things to keep in mind. Prevention is important. There are many vaccinations out there that can help prevent disease. Also, standard precautions. The equipment that you're using to protect yourself. Gloves, gown, eye protection. With our assessment, we may want to ask the patient if they have traveled recently, especially out of the country. And is the patient up to date on the recommended vaccinations? Patients suffering from infection or sepsis may be very anxious. Help to alleviate some of their fears. Understand how they may be feeling. Be sure that you wear your personal protective equipment, or PPE, at all times when having patient contact. And think about getting tested or receiving prophylactic antibiotics after an exposure to a patient who has been identified as having a communicable disease or sepsis. Beginning on page 678 of your textbook, we're going to begin talking about different communicable diseases that you may encounter. The first is chickenpox. This is caused by a virus known as varicella zoster virus. Signs and symptoms may begin vague and resemble a cold, but these individuals will likely develop a fever and a rash. The rash looks like little blisters and will get scabbed over as the disease progresses. These blisters and these scabs itch tremendously. Chickenpox is very contagious. It is spread through person-to-person contact and is airborne from the rash on the skin or mucous membranes. Dried scabs do not spread disease. This is an image of a child with chickenpox. You can see the red spots on the head and chest there. Patients are no longer considered contagious once the lesions have crusted over. They should remain in isolation until that time. Antiviral medications may help to shorten the course of the disease or even prevent long-term complications that can occur. However, antiviral medications do not treat chickenpox. Vaccinations are available for chickenpox and are usually given to the school-age child. Individuals may also receive the vaccine within 3 days of exposure to prevent developing chickenpox. Measles, also known as rubeola, is a highly infectious viral disease. It may start with a fever, a cough, and eye irritation or conjunctivitis. Patients may develop Koplik spots. These are white or bluish spots on the inside of the cheeks of the mouth or the roof of the mouth. Patients may also develop a red, blotchy rash that begins on the head and spreads downward. Here you can see a patient with measles. You can see that the red blotches are more concentrated up near the shoulders and chest area. Measles is easily spread. Individuals who have measles spread the virus through nose and throat secretions, through talking, coughing, and normal activities. This puts the virus in the air and it is then inhaled through droplets, infecting others. There is no specific treatment as this is a viral illness and supportive measures are usually recommended. However, prevention is possible through vaccination, quarantine, and good hand hygiene. Mumps is caused by the paramyxovirus. Usually patients will begin with vague symptoms again, body aches, loss of appetite, and headache. They can continue to worsen with swelling and inflammation of one or both parotid glands. The parotid glands are located just below the ears, kind of towards the neck. This pruritus can last 7 to 10 days. This patient has the mumps. You can see the swelling on either side of the face where the parotid glands are located. Mumps is spread with direct contact with someone's saliva and through droplets. Again, vaccinations are available to prevent mumps, and a quarantine for patients of 5 days after the swelling appears is important to reduce the spread of the virus. Hepatitis is a term that means inflammation of the liver. There are several types of hepatitis, but first let's start with hepatitis A. Hepatitis A is foodborne, and it has signs and symptoms including fever, abdominal pain, nausea, and loss of appetite, malaise or a lack of energy, jaundice, which is yellowing of the skin, and generally older adults tend to have more symptoms and feel worse with hepatitis A infections. This image is in your textbook as well. This patient has jaundice, yellowing of the skin, but you can also see the yellowing of the whites of the eye, or the sclera. Again, hepatitis A is usually spread through food, and that's because it's spread through the fecal-oral route, which means someone didn't wash their hands after they went to the bathroom, and then they cooked your lunch. There's really no specific treatment for hepatitis A. We do a lot of monitoring of these patients to ensure that their liver function returns to normal, but prevention is available through good hand hygiene, proper food preparation, and a vaccine is available as well. Hepatitis B is one of the more concerning types of hepatitis, especially for us working in healthcare. It is very common in many parts of the world. Signs and symptoms include nausea and vomiting, loss of appetite, abdominal pain, again, jaundice, and with this disease, younger patients have fewer or no symptoms, and they're much more likely to develop a chronic hepatitis infection. As I mentioned, hepatitis B can be transmitted through blood and bodily fluids, which is why it is concerning for emergency personnel. Semen, cerebrospinal fluid, amniotic fluid, vaginal secretions, and other bodily fluids have been known to transmit hepatitis B, although it is found in the highest concentration in blood. Hepatitis B is a virus, and there is no specific treatment. Vaccination is available, and proper decontamination is important for equipment after a call. Post-exposure actions may include washing any exposed area with soap and water. Say if you were to have a needle stick or a bite from a patient with hepatitis. You need to see a healthcare provider right away though. You still can get the vaccine at this point, or you may be able to receive immune globulin injections that help prevent the development of hepatitis B. Hepatitis C is similar to hepatitis B. It has similar symptoms with nausea, vomiting, loss of appetite, and a vague abdominal pain. Hepatitis C is also found in blood and bodily secretions. Blood-borne through shared needles is the most common way it is transmitted. It can be, but is less likely to be transmitted through intercourse or childbirth. There are some medications that are out there to help manage hepatitis C for patients, but there is no vaccine. So it's extremely important to protect yourself by using the preventative measures, including your standard precautions and disposal of any sharp material or contaminated objects. HIV is a viral illness as well. Many times it is followed by AIDS. Signs and symptoms of HIV may be flu-like symptoms occurring a few weeks after the HIV infection. Fever, sore throat, fatigue, but these symptoms are vague and many times go undiagnosed. AIDS is characterized by opportunistic infections. So a patient that has had HIV and has transitioned to AIDS is immunocompromised and cannot fight off common infections. So we see things like pneumocystitis or Kaposi sarcoma or tuberculosis coming and actually causing worse infections and possibly death. The purplish spots you see on this patient's chest and shoulder represent Kaposi sarcoma. HIV is transmitted through blood and bodily fluids, sometimes through shared needles, unprotected sex, any penetrative activity involving blood or semen, and sometimes during delivery or breastfeeding from a mother to her newborn. Antiviral medications have come a long way, and we now have medications that can reduce and suppress HIV viral load. Prevention is always key though. Standard precautions, safe sex practices, and not sharing needles is important to promote. Following significant exposure to blood or other bodily fluids, you should wash the area well and consult a healthcare provider for possible prophylactic treatment. Influenza, also known as the flu, is a common viral illness. Signs and symptoms include fever, non-productive cough, sore muscles, sore throat, headache, and weakness. In this image, you can see the medic is feeling the patient with their bare hand. The glove creates a barrier and may be unreliable for a temperature check. We now have temporal thermometers and thermometers that do not need to touch the surface of the patient's skin to tell us if they have a fever. Influenza is spread by droplets or direct contact. There is antiviral medication to help lessen the severity and shorten the time frame of an influenza infection, but they must begin within 48 hours of symptom onset. Prevention of influenza includes good hand hygiene, wearing a surgical mask, and vaccinations. We've noticed with COVID, influenza rates have been down because COVID and influenza have very similar transmissions. COVID-19, also known as the coronavirus, is a viral illness. Signs and symptoms are similar to that of influenza, with fever, non-productive cough, muscle aches, sore throat, headache, fatigue. But we see loss of taste or smell with some patients who have developed COVID-19. We also may see some GI symptoms, including nausea, vomiting, or diarrhea. Similar to influenza, COVID-19 is spread through droplets or direct contact. Antiviral medications can be used for COVID-19 as well to decrease the severity and shorten the timeline, but it must be taken early in the illness. Prevention includes hand hygiene, use of surgical masks, and vaccination. Croup is a common childhood illness. It is also known as laryngotracheal bronchitis. This is caused by the human parainfluenza virus, and yes, it is viral. Signs and symptoms include inflammation and swelling of the larynx, causing a harsh, barky cough. Children between 6 months of age and 3 years are most susceptible to it. However, it can occur outside of these age parameters. These patients usually present with a history of an upper respiratory type infection that progresses and develops into croup with this characteristic bark cough. Symptoms usually are worse in the evening or overnight hours. Croup is transmitted by droplets from coughs or sneezes, or even droplets that have landed on hard surfaces. Children should be assessed for airway and breathing problems, including shortness of breath. Hand hygiene is extremely important in the prevention of croup transmission. Children are likely to spread croup through daycares and preschools, they should be encouraged to avoid touching their nose, eyes, and mouth. Pertussis, also known as whooping cough, is a respiratory infection that is caused by Bordetella pertussis bacteria. Signs and symptoms usually begin like a normal upper respiratory infection or cold. It's likely to continue to worsen with a cough that is followed by a whooping sound on inspiration, as the individual is trying to inhale more oxygen. Pertussis is spread through larger droplets in the air. It is a bacterial infection and can be treated with antibiotics once diagnosed. Pertussis is preventable with vaccine, good hand hygiene, and refraining from touching the nose, eyes, and mouth. Pneumonia is a respiratory illness that can be caused by different microorganisms. Signs and symptoms typically begin with fever, chills, shortness of breath, tachypnea or breathing quickly, pleuritic pain or pain with breathing, productive cough, inflammation consolidated in part of the lung on an X-ray, potential febrile seizures in younger children and infants, and sometimes altered mental status in the elderly. Some patients will have mild symptoms, and it is uncertain what is going on with them until a chest X-ray is performed. Every patient should be evaluated in the emergency department. Here is a chest X-ray of a patient who has a right lower lobe pneumonia. You can see the cloudiness in the right lower chest. Pneumonia is spread by droplets, but requires close contact for several days or over an extended period of time for someone to get it from someone else. Treatment is most often done with antibiotics, and prevention can include good hand hygiene, coughing etiquette, like coughing into your elbow, and vaccination if you are of appropriate age. Vaccines for pneumonia are typically given to the young and the old. Tuberculosis is an illness caused by bacterium, Mycobacterium tuberculosis. This is very common in other countries, not so much in the United States. However, signs and symptoms include cough, which may have started out dry and then become productive, a fever, night sweats, and unintentional or unexplained weight loss. Tuberculosis is spread by coughing, singing, or sneezing. Not everyone will develop active tuberculosis. Treatment is available with antibiotics. EMS providers can help prevent the spread of tuberculosis by wearing an N95 respirator if they feel a patient has tuberculosis or if they have stated they have the disease. A high index of suspicion should be followed. Vaccines are available if needed. Otherwise, oral antibiotics will be given for prophylaxis if an EMS provider or someone else has been exposed. If you remember, the meninges is the thin film that surrounds the brain and spinal column. Inflammation of the meninges by the bacterium Neisseria meningitis is known as meningitis. Signs and symptoms of meningitis may include abrupt onset of a fever, usually a higher fever, nausea, vomiting, a severe headache, nuchal rigidity, which is soreness, stiffness in the neck. We usually will have the patient put their chin to their chest, and if that's uncomfortable, we consider that a positive sign. Photophobia or sensitivity to light, and possible petechiae. And petechiae are the little dots that look kind of like broken blood vessels that may be scattered on the patient. Here you see a petechial rash of a patient with meningitis. Meningitis is a serious illness and can be viral or bacterial. It is spread by direct contact, and treatment with antibiotics, if it is found to be bacterial is appropriate. There is a vaccine for meningitis that is usually given to the young or students that are getting ready to head to college that are going to live in close quarters with others. STIs are sexually transmitted infections. You may have heard them called STDs. Viral STIs include HIV, the hepatitis that we've talked about, genital herpes, and the human papillomavirus, or HPV. Some bacterial STIs include chlamydia, gonorrhea, and syphilis. All STIs are preventable. Safe sex practices with a barrier-type device are recommended for all types of sexual contact. Vaccination is available for some of the STIs mentioned. STIs are not a common reason for patients to call 911, but women can develop pelvic inflammatory disease if they have an STI that goes untreated. This may be from gonorrhea or chlamydia. Pelvic inflammatory disease causes severe lower abdominal pain. It may be associated with vaginal discharge, but this may be a reason why we are called. Living in the Midwest, we know that ticks are very prevalent and understand that some ticks, not all, do carry Lyme disease. Patients who are bitten by a tick and develop Lyme disease will most often have a erythema migrans reaction or a bullseye type rash. Treatment for Lyme disease is antibiotics and continued monitoring by their provider. Prevention is key, and that is to use your insect spray to cover your arms and legs with long sleeves and long pants, to be sure that you check yourself frequently for ticks, including in the hairline, and if a tick is found, it should be removed carefully with a pair of tweezers. Living in the world of COVID, we all understand that there are emerging and newly recognized infectious diseases out there. In some cases, the antibiotics we used to use are no longer effective against these pathogens. Bacteria have developed resistance. Patients may get infections that are no longer treatable, and they may die from these diseases that we used to be able to cure. Standard precautions are extremely important for you to protect yourself, your coworkers, and your other patients. Be sure that you are using it, donning and doffing it, or putting it on and taking it off appropriately. You may have heard of some of these, and then these may be new to you, but HIV or AIDS, again, different mutations. Severe acute respiratory syndrome, or SARS, are COVID-19. The Ebola virus disease, Middle East respiratory syndrome, and the Zika virus. Diseases vary throughout the world, so depending on where you are traveling to, it's important to identify what you may be at risk to catch. So we've all lived through COVID now for a while, and it's important to understand EMS is going to be called whenever these infectious diseases begin to have these outbreaks or pandemics. It's important that you remain calm. Be sure that you keep up on the news reports and the true factual information regarding these diseases. Many times the information can be exaggerated on social media and even on the news. Follow the recommendations of the CDC and your local health department. Your employer will give you direction and help you through this process. So, wrapping up the chapter, sepsis is a life-threatening condition. It's important to identify early. Septic shock occurs when we reach the point of hypotension that is not responding to normal treatments. Common sources of infection can lead to sepsis. The SIRS criteria can help identify a patient who has sepsis so that we can notify the emergency department of our sepsis alert. It's important to notify that receiving hospital of the sepsis alert so they are ready for your arrival and they have donned the proper PPE so they may assume care of the patient. When evaluating a patient with a fever or other symptoms suggestive of an infectious disease, be sure that you ask questions. Ask about travel and vaccination status. Working in EMS puts you at an increased risk to catch an infectious disease. This is why it's so important for you to use the standard precautions or PPE that is provided to you. When new infectious disease outbreaks occur, the CDC and your local health department will provide you with information and will continue to support you and your efforts. So think about each patient. Does this patient meet the SIRS criteria and potentially has sepsis? Make sure that you have all the appropriate PPE when caring for these patients. Again, do we need gloves, a gown, a mask, an N95? Try to recall the SIRS criteria, that alteration in vital signs or altered mental status, what body systems are going to be affected with sepsis, and what's different between incubation period and the period in which the disease is transmissible. Your book has a great chart that states the different incubation periods of diseases, and that is on page 672 and 673. We always talk that it is important to take care of yourself first, and vaccinations are the way to go for EMS providers. What are the differences in transmission routes? We know that any way you can take medication is a potential transmission route. The skin is there to protect us, but again, a break in the skin can cause bacteria, viruses, or other microorganisms to get in and cause infection. Symptoms of meningococcal meningitis, photophobia, and nuchal rigidity are the two that are going to be very unique to meningitis. Malaise or fatigue, headache, fever are common among many communicable diseases. So here's your question. You are being dispatched to a 2-year-old who has woke up her parents with a very loud cough. It sounds like a seal barking. The parents have never experienced this before, and they are near panic because it sounds terrible. What should you do, and how should you deal with this situation? Remember, croup is a viral infection that causes swelling of the soft tissue of the pharynx. This swelling can cause airway obstruction and breathing difficulty. So it's important first to identify if the patient is having an acute episode or an emergent episode. The patient is likely going to be transported to the hospital for a diagnosis and workup, but it's important to reassure the parents that this is possibly croup and it's a virus, and that most children are not affected severely by it.